Hello, everybody, and welcome to this 8th webinar of our series of online lectures, 9 months, 9 universities, which is organized within the framework of Workgroup 11 of the Arcus European University Alliance. My name is Barbara Gödecke, and I'm one of the experts on autonomous language learning at the Language Center of the University of Padua. The Arcus Alliance brings together 9 universities who share academic, scientific, and cultural objectives, a common vision of the role of higher education and research, and mutual fields of interest. Together, the partner universities are building an innovative and inclusive approach to education, research, and innovation. Workgroup 11 is the plurilingual and intercultural hub and aims to promote plurilingualism and to foster intercultural competences amongst the universities of the Alliance. The webinars of the 9 months, 9 universities series are intended to generate awareness and appreciation for the topic of multilingualism, as well as an understanding of the many areas of our lives that are related to and influenced by language. The webinars focus on specific topics related to language and culture and target mainly graduate and postgraduate students, as well as early stage researchers and all the staff interested in those topics. It's my pleasure to introduce you to today's speaker from the University Claude Bernard Lyon 1, Professor Christine Delprat. At her university, Professor Delprat is Professor of Immunology and President of the UFR Biosciences International Relations Committee. She carries out research in oncoimmunology at the Cancer Research Center of Lyon and coordinates the Master Life program, a master program of excellence in international vaccinology. Professor Delprat enjoys managing international training at the forefront of research in a multicultural and multidisciplinary context, particularly at the intersection with immunology, as well as discussing vaccines not only with current and inspiring vaccinologists, but also with the general public. In the webinar, Professor Delprat will present the results of innovative higher education and project management through reality projects in multicultural contexts with international students. She will report the training project, the bilingual results with open discussion on learning outcomes for international students, critical thinking on the importance of languages for vaccine future, and how to improve vaccine confidence to save lives. The webinar will consider how language affects the distribution and the understanding of vaccine information and how cultural and linguistic differences influence vaccine acceptance and show the importance of language and communicating training for future international vaccinologists. Before I hand over the screen to Professor Delprat, I would just like to remind those of you who are attending the webinar in real time to write their questions in the chat. And at the end of the presentation, we are going to have the time for Professor Delprat to answer the questions from the audience. Professor Delprat, thank you so much for sharing your knowledge and expertise with the Arcus community, and the screen is yours.
Good afternoon, everyone. So this is a pleasure to report about some action we perform in the Master Life with talented individuals who embark on an incredible journey of knowledge, of culture, and of personal growth also, and of course of language melting pot. So welcome to this webinar, and welcome to consider what is possible in Erasmus Mundus joint master programs. Erasmus Mundus program is a life-changing experience, not only for the students, but also for their professors, for the partners of these programs, and beyond for the world. I will tell you today the story of a bilingual real-life project carried out by Master 2 students of the Master Life. Life meaning leading international vaccinology education. So in this webinar, will first briefly present the background of the LIFE students, their advisors for this project, and the aim of this project called SAQinVAC. This is a real-life project. Then I will share their results, especially 2 videos to analyze the differences set up between English and French versions when we are talking about vaccine hesitancy. Finally, I will go through a new development concerning the concept of infodemiology and why languages are necessary for the future of vaccines. So let's talk about languages for the future of vaccines. Concerning languages, when you are talking about Erasmus Mundus program, you have a large choice of languages because you welcome several nationalities in this program. So for the Master Life, we have welcomed to date near 60 different nationalities in the graduates, and you have this map showing you in yellow the origin of the students from the world, in red the applicant, but not all of them had the opportunity to welcome on board, and in blue the few regions not interested by vaccinology, not interested in vaccinology. So the mission of this program, to understand the background of these students, is to focus on science, but with a multidisciplinary aspects of vaccinology. So talking about the science, when we want to develop vaccines, we need immunologists, and also when you are manipulating the immune system, you need to understand immunopathology. Of course, you want to target your vaccines to get rid of the microbes, so you need to understand infectiology. You need to build your vaccine products, so you need to understand industrial and regulatory affairs for vaccinology. And the internationalization is very important because it is, of course, a product that you want to spread in the world. And so we bridge the gap between basic immunology and infectiology, but also oncology, because we develop therapeutic vaccines against cancer also, and advanced operational vaccinology, so that these vaccines can benefit to the world. So we train the future generation of vaccinologists worldwide and with world experts on vaccines from and for the vaccination labor chain. So this is involving 50-50 public and private areas. 65% of the graduates are scientist engineer, but 15% physician, 10% pharmacist, and 10% veterinaries. So about the program, these students have the first semester in Spain, in Barcelona, the second in Belgium, in Flemish region of Antwerp. In the third semester, they are in France at the University of Lyon, UCBL, and we are coordinating this program from 2016, thanks to the funding support of the EACEA agency from the European Commission, and together with the 2 universities of Barcelona, UAB, UB, the University of Antwerp, and 2 universities in France, Lyon and Université Jean Monnet de Saint-Étienne. So we focus on what is done during the semester 3 between two teaching units. One is called Communicating on Vaccines and Public Health, and the second, Project Management. So during this teaching unit, some of certain projects are dealing with real results in the real life. So we can call them real life project or reality projects. They are very diverse, and the common point of this project is that they have a life. Really, it is not just to train the student, it is to obtain a useful product. So at semester 4, they have the classical master thesis. So in the frame of these two teaching units, we have involved during the 2021 year several students for this project, SAQinVAC. So just to present you the students, because this will help you understanding what they have done and with which quality. We have students from all over the world. So Margot from Belgium studied pharmaceutical science first at the University of Leuven, then the Master Live, and currently she is a medical advisor at MSD in Belgium. Vinicius from Brazil is a pharmacist from the University Federal do Rio de Janeiro, then the Master Live, and currently PhD student at the Max Planck Institute of Immunobiology and Epigenetics and the Würzburg Institute of System Immunology, so in Germany. Nino from Georgia is a physician from David Fildiani Medical University, then the Master Life, and currently PhD student at IGTP in Barcelona, in Spain. Camille Barrault has a double nationality, France and Burkina Faso. She's a scientist, graduated from Sciences Po and Sorbonne University with a dual bachelor in political science and biology. Then she did a Master Live and currently PhD student at Helmholtz. So why these 4 students were interested in the project? They have the wish to deal with public health, with anthropological issues in the world of vaccines. They are very interested in translating scientific knowledge into everyday decision making and in the transdisciplinary nature of vaccine hesitancy. They focus on social role of medicines and how people's decisions are shaped towards a rational or unrational use of drugs. They love when scientific knowledge is translated into an accessible, democratic way to everyone. They think that good intentions of scientists are not enough to make changes. We need educated policymakers who understand both the science and public health issues. And also they think that artists are one of the most influential people in the world, in daily life of people. And so they are interested in science popularization and to transpose scientific concepts into widely understandable ideas in order to demystify vaccines and vaccination. We have also Sakshi from India, project manager after the Master Life, she's project manager for the Infectious Disease Prevention Board and Control Board at the Vaccine Infectious Disease Institute of the University of Antwerp in Belgium. Denise from the Philippines, biochemist, and currently leading program associate in clinical operation at GSK Vaccines. Khalid from Sudan, involved in Bactivac vaccine community between UK and Africa. Sergio, physician and surgeon from Guatemala, is involved in managing humanitarian projects in rural Guatemala and 2 projects of charity clinics in Sierra Leone. So bringing together strengths from USA, Australia, and Russia. Among these 4 additional students, we found people with a deep interest on vaccine hesitancy. They have the keen desire to lose their knowledge both in the clinics and in basic science to promote vaccine education. And they think that innovative and creative means of communication are important. Khalid came into this project and in the Master Life intrigued by the safety and efficacy of vaccines. Now he believes developing vaccine is important, but people's acceptance and awareness of the importance of vaccination is more important. So they want to create sustainable vaccinology and public health program. They recognize vaccine hesitancy as one of the most challenging factors to confront in modern society. Therefore, they are excited to be part of this project. They were excited to conduct this SAQinVAC project and to develop new skills in order to tackle this issue of vaccine hesitancy. To conduct this project, they were accompanied with 3 seniors. One is Dr Hélène Valentin, CNRS researcher at the Cancer Research Center of Lyon and scientific referent for the project. She carried out deep research in onco-immuno-virology, and she's also involved in teaching, training, scientific communication, and she is the coordinator of the collective Vaccine Talks, which is a result of this project. Olivier Morin is also a PhD, associate professor in social science at the University of Lyon, and is carrying out his research at the center S2HEP. He is focused on social sciences, and main research is dealing with contributions and imitation of the integration of socially vivid questions in the construction of a critical and active scientific citizenship. And finally, we have Michel Le Gouis, director, actor, trainer, pedagogue, member of the collectives Vaccine Talks and of other initiative to bring to the general public science. His research is concerning questions how to stimulate the audience and consequently the theatrical form and representation as such. He's actor but also trainer at the film school factory. So with this team, the project called SAQinVAC is the acronym for Social Acute Questions in Vaccines. So just a few words about infectious disease. They, of course, have threatened our existence on Earth resulting in an endless fight for survival. So we fight against microbes and we fight against other humans. These are the main fight of humanities, you know. In the last 300 years, powerful tools to counteract the pathogens was created and called vaccination. We know it is efficient, and the best proof is the global eradication of smallpox. And with this eradication, basic questions such as how was that possible and why are other human diseases not eradicated if it was possible? We have several vaccines, but we have only eradicated one disease. So yes, it is efficient, but is it so efficient? Why do we have still so many diseases for which we have yet vaccines? So when you analyze, of course, you understand the effort launched by the World Health Organization in the 60s, and this global smallpox eradication program was a terrible effort to be successful. We also know that there is a second ongoing program of eradication against poliomyelitis, and we have in mind this last years the useful arrival of mRNA vaccines to fight the COVID-19 pandemic. So despite this success, vaccines are still considered controversial. How can a life-saving intervention raise so many question marks? This was the central question for the students, and they had to decide how to investigate, how to fight with vaccine hesitancy. They have decided to create free support. One was a booklet, another one a website, and a third one video to launch vaccines talk with the general public. So about the booklet, they had to discuss general aspects about vaccines, what they are, what they contain, how they are developed and chosen. They had to cover 3 vaccine preventable diseases: measles, hepatitis B, and the human papillomavirus-induced cancers. The vaccines for which are deemed controversial, especially in France. And maybe you have heard about the controversy about autism and measles vaccines, about multiple sclerosis and hepatitis B vaccines. And in a different area, the controversy about sterilization and the use of human papillomavirus-induced cancer. So they have deeply studied these 3 controversies and gather information, reliable references, and this is analyzed in this booklet to explain the concept called vaccine hesitancy, its causes, consequences, and arguments. Of course, the aim of the booklet is to share some conclusion, the way forward, and the reliable references. Then they have built a website where you can find all the information you need to understand vaccine and vaccine hesitancy in order to take part of this contemporaneous debate. So on this website, you find case studies, frequently asked questions, useful links. What is vaccine hesitancy? What are vaccines? And facts and graphs. And finally, they have created 2 videos, one in English and one in French. And they have conducted specific studies to create these videos with the advisors, because the conclusion was that when you are talking about vaccine hesitancy, you need to understand what are the roots and how the culture is supporting these roots of the vaccine hesitancy. And these roots are different from one country to another. Also, the cultural and social habits in different countries generate different hesitancy. So we need to understand more than science. We need to understand the other human beings, those who need to use the vaccines for their benefits. Why did they develop hesitancy? And having thought about that, they have created for the same concept different videos. So I propose you to look at these videos and to see what are the main differences. So one is in English, the other is in French. The one in English is rather to be dedicated to be distributed in English speaking countries, and the one in French rather in France, where you have a great background of hesitancy. So let's start with the English video.
Once upon a time, a very generous, kind, and loving family of Lancasters was ruling the Kingdom of France. The Queen and the King had 2 sons, Thomas and Hugo, and 1 daughter, Julie. They got along very well. They played together all the time and never had arguments, as siblings usually do. However, they would always have debates about one topic which they couldn't agree on, and this was vaccines. Now, you may ask what vaccines are and why do we need them? Well, let me explain. When you get sick for a few days due to an infection with a nasty microbe like the measles virus and then potentially recover, it's because your body, more especially your immune system, fights the virus. The second time you encounter the measles virus, your immune response will be much faster, and maybe you won't even realize that you were infected by it. It's because your immune system has a memory and can remember the previous infection. It has learned from the first experience how to fight this specific microbe so it can protect you the next time you encounter it. The measles vaccine is a substitute for the first infection. We inject you with the compounds that look like the measles virus but don't cause the disease. It's called an antigen to educate the immune system. This is very important since the measles virus and other microbes as well can lead to severe illness, lifelong disabilities, and even death. Fortunately, in most of the cases, these can be avoided with the use of vaccines. According to the World Health Organization, 2 to 3 million lives are saved every year thanks to vaccines. But as every medal has two sides, you might remember that sometimes doctors use needles to vaccinate kids, which might cause some pain. Sometimes children might have very mild symptoms of the disease after vaccination, and very, very rarely severe allergic reactions can happen. Fortunately, it is very, very extremely rare, and doctors know how to handle it. Now, back to the royals. One fine day, during breakfast time, Hugo was reading the daily newspaper. He was very excited to learn that Mr. Hilleman, the scientist who invented a measles vaccine, was awarded as the best scientist in the world. However, Thomas was not thrilled with this news. Not at all.
Hugo, Julie, tell me, why do you like this scientist so much? With vaccination, he's infecting people, and this vaccine has a virus inside. It's called measles. Do you know what is that? It's an infection that affects mainly children, causing rash, high fever, sore throat, and cough.
Well, I like him because he invented a vaccine which helped to save a lot of people. But I agree with you, Thomas. Some vaccines may contain the virus itself, but it's either weakened or killed. It depends for which pathogen the vaccine is for. But it's very, very rare for a vaccine to cause infection in children. This is what the scientists say.
Actually, I'm not sure about him either, because our family doctor says that he's a good man, but then my friends say that his vaccines are not that good. What should I think?
How so? Why do you think that they are not good? What is your point of view in this? I would love to hear it.
I read that some children actually got the disease after they were vaccinated.
You know, Julie, I have read that too.
But have you read that measles kills a lot of people worldwide, and that this vaccine has saved millions of lives since it was made?
I didn't know that. Now I feel very bad for children who were not vaccinated and actually got the disease and maybe even died. That's sad.
But that's only written in the books. Julie, Hugo, tell me, have you ever seen someone sick with measles? Here in our kingdom or in our neighbor kingdom of Shrek? I don't.
Ah, yeah, I remember it now.
Yeah.
It made people very scared of the vaccine. And I can really understand it because parents usually want the best for their children. They want them to be safe and healthy. But I'm going to tell you the story about it.
Wow.
There was Dr. Wakefield, who was very interested in vaccine production. He wanted to sell a specific vaccine against measles and to denigrate the competitor one. He made a huge announcement on national TV saying that the competitor measles vaccine was the reason behind autism. Can you imagine how shocked and worried parents were? But little did they know that Dr. Wakefield was lying about his discovery. He wanted to become rich and famous, and that's why he lied. Since that, parents are still very concerned. What if Wakefield was right?
But he was not. Many scientists proved he was wrong.
Wow, I didn't know that. Now I see why it's so important to have measles vaccine around. But you know what? I'm still not sure about the other vaccine that is very, very popular right now in our kingdom. Do you know what I'm talking about?
Julie, are you talking about human papilloma virus vaccine?
Hey, I see that our opinion varies according to the vaccine that we're discussing, but now I would really love to hear what our audience thinks about the topic.
So then we move to the French one.
Il y a bien longtemps, naquit en France une nouvelle, généreuse, gentille et aimante famille appelée République. Cette République grandit très rapidement et eut de nombreux enfants, des citoyennes et citoyens à qui elle donna la parole.
Moi, je pense que...
Je ne suis pas d'accord, non, si
Non,
tu
mais
dis
ça
ça...
suffit maintenant, laissez-moi parler.
Et la possibilité de débattre. Non, pas de se battre, débattre. C'est le principe même de la démocratie.
Bon, bah, lâche-moi maintenant.
Cependant, ils comprirent malgré eux qu'il n'était pas toujours facile de se mettre d'accord. À cette même époque, un médecin anglais, Edward Jenner, découvre un moyen de prévenir la variole.
J'ai la variole.
Et c'est presque 100 ans plus tard que le scientifique français Louis Pasteur crée le premier vaccin contre le choléra. Mais ces scientifiques ne s'imaginaient pas que leur découverte allait provoquer autant de débats.
C'est quoi un vaccin?
Très bonne question. Qu'est-ce qu'un vaccin? Un vaccin permet d'éduquer notre système immunitaire pour empêcher le développement d'une maladie. Lorsque tu tombes malade à cause d'une infection due à un virus et que tu en guéris, c'est parce que ton corps, plus particulièrement ton système immunitaire, a combattu ce virus. Et la prochaine fois que tu rencontreras ce même virus, ton corps aura une réponse immunitaire beaucoup plus rapide et efficace. Tu ne réaliseras peut-être même pas que tu as été infecté. C'est parce que notre système immunitaire a une mémoire et qu'il s'est souvenu de l'infection précédente. Il a appris, lors de la première infection, comment combattre ce virus. Et ainsi, il pourra nous protéger la prochaine fois que nous le rencontrerons. Le vaccin, lui, mime une première infection. Prenons l'exemple du vaccin contre la rougeole. Le vaccin contient des composants ressemblant à ceux du virus, mais qui ne sont pas dangereux. Quand le vaccin est injecté dans notre corps, c'est pour entraîner nos cellules à se défendre contre la maladie, mais sans tomber malade. Sans le vaccin, ce virus pourrait avoir des conséquences graves pour notre santé et entraîner des incapacités à vie, voire même la mort. Selon l'Organisation mondiale de la santé, 2 à 3 millions de vies sont sauvées chaque année grâce au vaccin. Mais il y a un revers à cette médaille. Les médecins utilisent souvent des aiguilles pour vacciner, ce qui cause une douleur à l'endroit de l'injection. Il arrive aussi que des symptômes très légers de la maladie apparaissent après la vaccination. Et très très rarement, des réactions allergiques sévères peuvent survenir. Heureusement, c'est vraiment très très rare. Et les médecins savent très bien comment les gérer. Cependant, aujourd'hui, la vaccination fait toujours débat.
Vaccination pour tous!
Et ma liberté de choix, t'en fais quoi?
Les garçons, vous n'allez pas encore vous disputer.
C'est lui qui a commencé.
Bon, mais c'est qui ce bonhomme-là?
Mais c'est Hillman, le scientifique qui a créé un vaccin contre la rougeole.
Sais-tu au moins ce qu'il y a dans son vaccin?
Non, pas précisément. Mais je sais ce que c'est que d'avoir la rougeole.
Oui, nous aussi, on sait. C'est une infection qui touche principalement les enfants, provoquant des éruptions cutanées et une très forte fièvre, blablabla.
Mais aussi une otite et une pneumonie. Donc, merci, docteur Hillman, d'avoir trouvé un vaccin qui va aider à sauver beaucoup de vies.
La vaccination, Milo, c'est infecter des gens avec un virus.
Pas tout à fait, Thomas. Parfois, les vaccins contiennent vraiment des virus, mais qui sont tués ou affaiblis. Il est très très rare qu'un enfant développe des maladies graves à cause de la vaccination.
Pourtant, j'ai des amis qui pensent que certains vaccins sont dangereux pour la santé.
Comment ça?
J'ai lu sur Internet que certains enfants ont attrapé une maladie à cause du vaccin contre la rougeole que ton scientifique préféré a fabriqué.
J'ai lu ça aussi.
Mais savez-vous que la rougeole tue beaucoup d'enfants dans le monde et que ce vaccin a sauvé des millions de vies depuis qu'il existe?
On peut mourir de la rougeole? Vraiment?
Enfin ça, Luna, c'est ce que dit Milo. Mais franchement, vous avez déjà vu quelqu'un malade de la rougeole, vous, en France?
Mais justement, Thomas, c'est grâce au vaccin qu'il n'y a plus de rougeole en France.
Pourtant, j'ai entendu aux infos qu'il y a de plus en plus de cas de rougeole en ce moment. C'est bizarre, non?
Oui, bon ben, des maladies, il y en a toujours eu, hein.
Tu as raison, Luna. C'est justement parce que de moins en moins de gens se vaccinent que cette maladie réapparaît.
Ah, tu veux dire que si tout le monde était vacciné, la rougeole n'existerait plus?
Non, mais elle ne circulerait plus. Avant, la rougeole était très répandue et beaucoup d'enfants étaient malades, et certains en mouraient.
Donc finalement, on a peut-être eu de la chance que nos parents nous aient fait vacciner alors.
Mais franchement, Milo, la rougeole n'est pas une maladie grave. Par contre, le vaccin contre la rougeole, lui, il a rendu des personnes autistes. Tu le savais ça, toi?
L'autisme? Attends, c'est ce trouble du développement qui empêche les enfants de communiquer avec les autres?
Oui.
Qu'est-ce que ça a à voir avec le vaccin contre la rougeole?
Rien, c'est ce que je m'efforce de lui expliquer. Ah, d'ailleurs, je vais vous raconter l'histoire qui a conduit à cette idée fausse. Le docteur Wakefield était très intéressé par la production de vaccins. Il voulait à tout prix vendre son vaccin contre la rougeole et faire disparaître ses adversaires. Pour ce faire, il a annoncé au monde entier que le vaccin concurrent de la rougeole était responsable de l'autisme. Mais nous ne savions pas alors que le docteur Wakefield n'était pas honnête. Il voulait devenir riche et célèbre. Et pour parvenir à ses fins, il avait propagé ce terrible mensonge. Malheureusement, cette fausse rumeur n'a jamais cessé d'exister. Et depuis, le monde scientifique a prouvé qu'il avait bien menti.
D'accord, admettons que le vaccin contre la rougeole soit une bonne chose. Mais le vaccin contre le papillomavirus humain, par contre là...
Ah, voilà l'exemple type de vaccin qui est trop récent pour être sûr.
Moi, ce que je sais, c'est que ce vaccin aide à éviter certains cancers.
Eh bien, Milo, moi, j'ai entendu beaucoup de mauvaises choses à son sujet.
Mais comment peux-tu être certain que ce que tu as entendu est vrai?
Moi aussi, j'ai mes sources. Et je peux te dire que le vaccin contre le papillomavirus est très cher. Alors autant dépenser cet argent pour le dépistage précoce des cancers dus à ce virus.
C'est tout de même pas simple de se faire une opinion. On entend tellement de trucs. Et je ne te parle même pas des vaccins sur la Covid-19. Et vous?
Ah oui? Et vous?
Vous en pensez quoi de la vaccination?
So, I don't know if you can use the subtitle if you don't understand all the contents because this is in 2 different languages, but at least you have noticed that for the international broadcast, they have chosen to use the diverse skin color to have a video with the colors of the word, and they have used young people to target young populations so that they can identify themselves better. Choosing sibling is also a way to make some reference to large families. And for French, the French video, you have seen that the choice was to use people with senior ages. And national reference, because they have analyzed that French are proud of their revolution, proud of their democracy, proud of several cultural references, and they have also analyzed different points of attention supporting the hesitancy. So the needles, the use of needles, the liberty, freedom to choose what you want to do, the internet misinformation. And so you can notice that there are some common points. They mix different point of view, because this is the reality in the world, and they mix serious consideration with point of humors. This is working well everywhere. And also they try to educate that people should try to discriminate what is misinformation compared to information. But of course, it is not easy for a general public to know what is true, what is not true. This is one difficulty. And also you have noticed that for the French video, you have a kind of mirror of the French people, because they are fond of giving arguments which are not supported by facts, but distributed efficiently in the society. So the rumor and the misinformation, you have more raise. You have in the French video to raise about the roots of social vaccine hesitancy in French society. So just to tell you that when we build a communication, we need to be efficient to use the languages of the country we are targeting, and also it is necessary to understand the culture, what these people are proud of, because you can better understand them first, which is very important, and then try to make them discuss together. So this is very important to educate vaccinologists with different languages, and also to sensitize them to the different culture and the roots of what is preventing to spread vaccines when it is beneficial and necessary. So finally, the last evolution we have in the Master Live is that we have launched a new teaching unit called Vaccinology and Epidemiology. And it's a MOOC course that we will open to, we can already open to the world. For the moment, it is in English, but we have the objective to develop several languages, and also to involve the Master 2 students in the frame of their training to translate, but it is not just a language translation, as you have understood. It is a translation for different society and different context. But when you are talking about infodemiology, you are talking about understanding the basic clinical and social aspects of vaccinology. But you want also to develop decision-making skills to discern quality information from unreliable sources and to educate people to become able to perform risk-benefit analysis with you. And well, it is based on interactive exercises, video recommendation, and analysis of the power of facts, rumors, fears, and how to conduct a syndromic surveillance for global health infodemiology management. So infodemiology is a portmanteau word with information and epidemiology. And infovalence is also a portmanteau word built with information and surveillance, because we need to take into account how in quantity, in quality, the information is spread via the social network to counter what is mis or disinformation, and to support reliable information useful for public health and vaccine development. Thank you.
Thank you, Christine. Thank you so much. I don't see upcoming questions, and even if I think that's a bit sad, I'm also very happy because now I can ask you my questions, which because I was really impressed by the whole course and also the booklet. Is the booklet available somewhere? Can I find the booklet your students prepared somewhere?
Yes, so the booklet is available for free. You can download it in PDF or you can read it on the web. And if you go to the website, I think maybe we can give this reference with the video. You have all the access to the booklet, to the video, and also to the information available as short story with button directly on the website.
Okay, great. There's been a question in the comments now. There's a person who says, thank you very much for this interesting presentation. The question is this: since we are talking about the importance of access to vaccines to save lives, isn't the problem more financial or even? And then it doesn't, I can't see how the question goes on. Well, let's just take the first part then. Is it a financial problem or more a problem of approach or hesitancy of the people who should get vaccinated or should get their children vaccinated?
Yeah, of course, the financial issues must be understood. Basically, when we are talking about vaccination, we are talking about also calculation of the cost of the disease compared to the cost of the vaccines. And we are also talking about who should benefit from this vaccine and is it able for these people to pay for the vaccines. But if it is not possible, you still have the possibility, and it is done to collect fund from people who agree to support vaccination and vaccination program worldwide, and you can contribute to pay for the difference, what they cannot cover. You collect money from different states, and it is sent to the World Health Organization to organize vaccine campaigns. So, of course, you must be able to cover the cost of the vaccines. But there are many solutions now, because you have also factories creating, building, producing vaccines in developing countries now, so that it is more accessible. But yes, this is a global problem, to distribute money and vaccines.
Yeah, but also the cost of, I mean, not even talking about the cost of human lives, which is out of discussion, but also the cost of people just not being vaccinated and therefore falling ill is a cost.
Yes, well, the economic discussion is a very important discussion, and you know, yes, you have a calculation of the cost of the life, which is different between countries on the planet due to the wealth of each country. But also we know that when we improve health and education, you develop the country, and then the country is becoming more rich. So we should also consider that when we improve health on site, they will be able to create wealth for themselves better.
And waiting for other upcoming questions, I would like to know, how can, like, language barriers can hinder the access to vaccination services. Obviously, that's an obvious point. But what do you think? You personally think, how can that be avoided? How, or what can be done in order to avoid, language barriers in countries, because our countries are always more multilingual and multicultural?
Yes. That's a good point. That's very important. You have, especially, for example, in Africa, you have so many languages. Some of them are spoken by few people. And so, for example, we have physicians from different African countries welcomed in the Master Live, and they are speaking 3 to 5 different languages to be able to help people with their health. So it is true for vaccination, but it is true for all other aspects of their health. You must understand what is their problem.
Yeah, that's also a point.
There is the problem of the lack of information. If vaccination information is not available in a language understood by the target population, individuals may not be aware of vaccination schedules, location, and the importance of vaccines. There is the problem of misunderstanding instruction. So people might misinterpret vaccination instruction, leading to missed appointment, improper preparation for vaccination, or incorrect aftercare practices. There is, of course, the fear and the mistrust, and the language barriers exacerbate fear and mistrust of medical systems in general. So if patients cannot communicate effectively with healthcare providers, they may be less likely to trust the information and services provided. What is far from you, you don't trust. Yeah.
Yeah.
Then also you can have difficulty when you you need to perform clinical development before the vaccines is used for a large population, because of course you don't want, especially if you want to inject the vaccines to a generation of babies, you cannot kill a generation of babies. This is not acceptable. So, you need to conduct clinical vaccine development, and you can have difficulties in consent process. So informed consent requires that patients understand the risk and benefits of vaccination, and the language barriers can prevent proper communication, making it difficult for this phase of clinical vaccine development. So this is a problem, especially when you develop a vaccine in developed countries against a disease which is mainly in developing countries, and you need to conduct the clinical vaccine development where the disease is, of course.
That's also why it's necessary to have courses like, or to have international courses which are from so many different countries, with students from so many different countries, and spreading the information on the informers.
Exactly.
Yeah.
Exactly. This is one of the major reasons for this Master Life program, is to create a task force of manager with different languages, so that they can educate their own country in their own language.
And as both of the videos, in both of the videos, there was this, one of the reasons for vaccination hesitancy is the question of misinformation and rumors of any kind with social network or with online platforms, which are now make it so easy to spread information, but also misinformation. Have you, is there already, can one already say if there, quantify the effects of misinformation or the way they contribute to vaccination hesitancy? Or is that was just a question. I was wondering if there has been some research on that.
So this is the field of infodemiology, which is which has just been launched. So yes, we have now the development of tools to collect information in database to have a kind of forecast about misinformation.
In order to prevent,
yes, because
to know at least where to,
allowing misinformation to spread quickly across geographical and linguistic boundaries is a problem, of course. So, so we have currently the development of algorithm on social media to measure the information on the web what is circulating and in which countries. These kind of tools have been created for other reason than vaccinology, but
Yeah,
it is now used for public health. And but for the moment, we need to improve the collection and to see, because we are just starting to conduct action to counter what has been measured. And we need to develop the countermeasure, and we need also to develop the way to measure whether it is efficient or not. So yes, we know that there are global reach, there are echo chambers, there are lack of moderation, they are influencers and community leaders. They have the possibility on the web to translate misinformation and to adapt to fit the cultural context of different language communities. So this makes the misinformation more relatable and believable to those communities, of course. So also the visual and multimedia content on the form of videos, infographics, and make it easier to spread false information visually and emotionally also, rather than through textual content alone.
Yeah, as when you explained, I mean, we could see it, and when you explained the difference and the different choices before, why the video in English language was made in one way, and why which were the points the French video was pointing at or trying to
yes, and
get
there is community specific concerns. For example, when the HPV vaccines was introduced in some countries such as Egypt, they were afraid that it was to sterilize the women, for example. So this fear we don't have in France. We have others, but not that one.
Yeah.
And so depending on the specific concerns of the community, the misinformation can exploit specific fears and concerns within different language communities to make it more persuasive. So what is true for information is true for misinformation in reality.
Yeah. Yeah, and just a very last question from my side is, apart from taking part in a program, in a study program, also because one has to wait till the first managers or until there are more managers around who have trained themselves on these programs. Cultural competence, how can that be improved? Is there a way to improve it in daily life also, something which is not only scientific or not so specifically scientific, because I hear opinions about vaccinations, which I don't agree on, but I found myself pretty much in the same situation as the people in the video, and not always the outcome is so easy. So is there some, apart from the argument of science, which proves that where people are vaccinated, there is an improvement on the health of the society, if we cannot have another,
in reality when you have fear, science is not so useful, because you need to first understand the root of the fears. So you need to understand the cultural beliefs and practices. So understanding attitudes towards health, medicine, and vaccination is important because when you have understood, you can ask, you can make people thinking about their own roots and not about science, just the roots of their fear. Also, sometimes the goal is not to induce a change in their minds. Sometimes, you only need to understand what is the who is the reliable leader for these people. And if the leader is convinced, then he will tell people to do it, and they will do it. So sometimes, well, as a French woman, we want to explain, we want to convince people. But if you know that the action to vaccinate and you have the scientific proof yourself that it is a good action in this context, what you need to understand is the way to convince them. It is not obviously with science. It can be just understanding who is their leader and how to use culturally relevant messaging to resonate with the cultural value and experiences of the target audience. So if you use culturally appropriate symbols, narratives, examples that the community can relate to, you can conduct your public health action. And but of course, providing multilingual resources is really very useful. So translating materials, ensuring translation are accurate and culturally appropriate, and using also various communication channels, a mix of communication channels that are popular within the community. Sometimes it's the radio station, sometimes it's a newspaper, sometimes it's a social media platform, community centers. It can be different way of action. And the most important thing is to understand. Just listen to them first. First, listen to them to understand where are the roots, how you can conduct your public health action and manage these roots of misinformation or fears they have. And the percentage of anti-vax is very weak in reality. A lot of people need to increase their confidence in vaccination thanks to a host community event discussion. That's why we have created these vaccine talks. And these small videos, they are used, for example, in meeting with the parents just to launch the discussion. And you create an event and you organize community event, webinar, town hall meeting where people can ask questions, discuss their concerns with healthcare professionals in a culturally sensitive manner. And this is very useful to lower hesitancy and increase confidence in vaccines. So also what is useful is to promote positive stories and models. So share success stories, testimonial from community members who have been vaccinated, highlighting positive experiences can encourage others to get vaccinated.
Mhm.
And another thing is also to respect and to address the religious beliefs. If they are religious considerations related to vaccination, work with religious leaders to address these concerns respectfully and provide information that aligns with religious teachings and values.
Mhm.
Understanding the values and the belief and the fears is the key to help people making the good choices.
Yeah, so the right communication means accepting
The difference.
Yeah, the difference with
First.
the other. Yeah.
First, don't try to
No.
say what you know. To just listen to people
Mhm. Mhm.
and understand the roots,
Mhm.
and then you will be in better position to find a solution.
Sounds very sensible. Okay, so I don't see any other upcoming questions. So thank you so much again. That was really great talk, and yeah, thank you.
Okay, thank you for inviting me, and I wish you a nice end of day.
Yes, for you too. Bye, Christine.
Bye.